This is the Check Now HIV self-testing kit, a new technology to quickly detect HIV infections. Ugandans can now know their status in a private and convenient setting.
This kit will be an additional tool in our arsenal for HIV testing, which is the key entry point for HIV prevention and control interventions.
The self-testing campaign is targeting most at-risk populations, such as young people and men who fear testing in public. In less than 20 minutes, one can tell his HIV status after testing with this self-testing kit. Health authorities are now promoting self-testing kits as one of the ways to reduce HIV/AIDS infections in the country.
So guys, this is a brilliant invention of the 20-minute self-take AIDS test. And this is needed globally, on a global scale. Why? Because there's still a stigma on AIDS. Some people don't want to get tested because they don't want to walk in the actual facility and see, I don't want to see them going in it to be stigmatized. So this would be work. I think I would love for Uganda to export this globally and make some money off of it, as well as it be good for the world. And quick reminder, don't forget to like, share, comment, and subscribe, tell a friend. Don't know, boom. Once you like my content, we can keep this rolling. So subscribe, help the channel to grow. So thanks for watching. Anyway, back to the AIDS test. So imagine you meet a girl and you want to know if she's clean. You have this test. You say, look, baby, take this test. 20 minutes, nobody won't know. It's a self-test. You can go and take it yourself. 20 minutes time, we know your status, and I can take one as well. So this should be applicable globally and to every race, and it would help lessen the stigma of AIDS, because then you have more people who take AIDS. They would know their status. They would know the medical status if they're infected or not. And then this can save marriages, it can save relationships, and it will be able to help people to have a more, a more trustworthy interaction with each other. So let's finish the video before we go any further.
The new testing kit alerts those who are found not to be sick to protect themselves, but also helps to link patients to care. Users are given a specific code to transmit results to health workers. The goal is to hit the UN 95-95-95 target by 2030.
For all people who could be having HIV, 95% of them, we have not achieved the percentage of 95% of them knowing that they have HIV. So we must therefore scale up testing programs to bridge that gap of making sure everybody knows his HIV status.
And many Ugandans have now welcomed the self-test kits.
Many people at the universities do not want to know their status because of many factors around them. So with this kit, it just makes everything simple.
Men didn't want to go. They don't want to involve going to the hospitals. They always think that maybe they don't have that time. But if you have it at home, yes, you just test yourself.
However, there is a fear that the test kits are still unaffordable to the targeted population. The government is now pushing for donor funds to make the HIV test kits available at a subsidized cost. Uganda's HIV prevalence rate stands at 5.8% among adults, but health authorities are pushing to bring the figure down to 0 new infections, hopefully by 2030.
So here, my final thoughts. You see, again, as I was saying earlier, it's a stigma still attached, especially men. Men don't want to get tested. They're some of the ones that hate. Men in general just don't like to go to the hospital, and don't like to get tested for nothing. So if you can sit down in your home, boom, prick yourself, put the blood, get the test, get the result, and get a code, and you bring it, and boom, you find out if you're clean or not. And the only option I see with this now, I hope for them to make this affordable. So it's like going to the shop to buy a condom. I hope it's like on that level where it's easy to have, you have easy access to this product, and the pricing is not that expensive as well, because people who are not financially stable won't want to go through this procedure either, because they say they rather use the money to buy food than to go and buy a test just to get it. But if it's accessible globally, will have less infection because someone actually know that they're not infected, and they can confidently state this. And it can save people as well from getting infected by, if you take a test and then you come out positive and you know, okay, you're positive, so we can have a sexual relationship on that level for me to get, you know, the procedure. So it's a win-win, and I take it. So let's hope they can get to push this globally, and other governments, especially in Africa. Why I say especially in Africa? Because for the stigma, there's a stigma in Africa right now, but it's Africa's high in AIDS, which I don't believe, but there's a stigma. But this will help clear that stigma. Because more Western countries are way more promiscuous than the African nation, so it will help globally as well. So this is I like this. I love this. I hope it's pushed and more people have access to it. I don't know. Thanks for watching. I don't know. It's a Washington Assistant Podcast. Tell a friend, like, share, comment, subscribe. Peace. One love. Boom.